Today, we're pulling back the curtain on something called CMC. That's chemistry, manufacturing, and controls, and why it is the hidden hurdle to getting a drug approved. So let's just start with this number because it's pretty wild. About half of all drug applications that get rejected by the FDA, they don't fail because the drug didn't work in clinical trials. Nope, they fail because of CMC issues. We're talking everything from the physical building where the drug is made, to the data proving it's stable, to all the quality control paperwork. It's a huge deal. And when those CMC problems are bad enough, the company gets one of these, a complete response letter, or CRL. Honestly, just think of it as the ultimate no from the FDA. It basically slams the brakes on the entire approval process, and let me tell you, avoiding a CRL is the name of the game. So how do you dodge that bullet? Well, it really just boils down to one simple thing: your mindset. You see, there are two totally different ways to handle the whole regulatory process. You can be reactive, just doing the bare minimum, or you can be strategic, thinking 5 steps ahead of the regulators. And this table really lays it all out. The standard reactive approach, that's all about just ticking boxes, filling out the forms just right. But the strategic mindset, that's about designing your entire manufacturing process so well that the FDA barely has any questions to ask in the first place. One is about fixing problems as they pop up, the other is about preventing them from ever happening. And here's the kicker, the goal. Standard compliance just wants to get the license. Strategic CMC wants to get the license fast, and with a process that actually makes business sense. Okay, so that all sounds good in theory, right? But let's look at how this actually plays out with a couple of real-world scenarios you might run into during your career. First up, let's talk about one of the most high-stress moments in this whole journey, the pre-approval inspection, the PAI. This is when FDA inspectors literally show up at your factory to walk through the facility and make sure everything is perfect. No pressure, right? And this right here, this is a sentence you pray you never see in a CRL. It's the official reason for failing that inspection. It means it doesn't matter if your drug is a miracle cure. If the inspector finds a dirty room or sloppy paperwork, your application is basically dead in the water. So what's this strategic play? It's called a mock PA audit, and it is absolutely brilliant. The company actually hires former FDA inspectors to come in and raid their own facility. They pay these consultants to be as tough and critical as possible, to find every little flaw, from a missing signature to a tiny crack in the floor. You find and fix all that stuff months ahead of time, and the real inspection? It's a walk in the park. Okay, let's shift gears for our second case study. We're moving from the factory floor into the lab, and we're looking at the hard data, specifically the data that proves how long a drug is actually safe and effective to use. Here's another quote that will give you nightmares. This basically means you told the FDA your drug is good for 2 years, but your own data doesn't back it up. Maybe over time, some unknown substance starts appearing in the drug, a degradation product, and you have no idea what it is or if it's dangerous. That is an automatic rejection. So what's the strategic fix here? Well, instead of just waiting around hoping for the best, a strategic team runs what are called forced degradation studies. They literally torture the drug. They blast it with intense heat, light, humidity, anything to try and force it to break down. Why? Because that's how you figure out exactly what could go wrong, so you can identify every single one of those potential bad actors before the FDA ever sees them. And this is the beautiful result of all that work. An FDA reviewer looks at your data, sees a little unexpected blip, and asks, hey, what's this unknown peak? The reactive team starts sweating, but the strategic team, they calmly respond, oh, that's degradant X. We already identified its chemical structure, and here's all the toxicology data proving it's perfectly safe at these levels. Boom. Question answered, problem solved. So when you put these two case studies together, you start to see the bigger picture. The winning strategy isn't just about having good science. It's a completely different way of thinking about the entire process. And this right here is the main takeaway. Look, the real goal isn't just to get the license. Anyone can do that eventually if they just keep trying. The goal is to get the license fast, and to do it with a manufacturing process that's efficient, reliable, and profitable. Strategic CMC is where good science meets good business. So I'll just leave you with this question. As you get ready to start your careers, whether you're in a community pharmacy, a hospital, or in the pharmaceutical industry, you're going to come across these kinds of challenges. And the mindset you bring to the table, reactive or strategic, is going to make all the difference. So Which one is it going to be?